Hi everyone, we will continue with the CCS. Imagine a girl come to your clinic with a webbed neck and no menses. So you think of several differentials. You think it could be primary amenorrhea, it could be Turner syndrome, it could be hypopituitarism, it could be hypothyroidism, it could be constitutional growth delay, it could be dwarfism. So what do you do in this case? In this case, you do physical exam. You see a lot of signs of and symptoms of Turner syndrome. So what do? You order karyotype, FSH, LH, and you follow up in 2 weeks. Come back in 2 weeks. When you come back in 2 weeks, confirm the karyotype, confirm it's a Turner syndrome. So what do? You do fasting glucose, CMP, UA, lipid, and TSH. And then you do ultrasound of the renal, pelvic, echo, skeletal survey, and hearing test. You gotta know these things because it hits the heart, bone, it hit the ear, it hit the kidneys, horseshoe kidneys. It hits a lot of stuff. It's a chromosome. It's a big deal. If one gene changes, it could affect your whole life. How about if the chromosome changes? Okay, so this is important. After that, what do? You treat. Okay, in the second visit, you start treatment. Growth hormone, you give vitamin D, calcium, dietary consult, psych consult, and counseling, education, and follow up in 2 weeks. And the case end at that time. Okay, so now there's other stuff that I want to talk to you about for the Turner syndrome. So Turner syndrome, growth hormone. So when do we give that each? Growth hormone for height less than 5th percentile, and steroid for if the patient from 9 to 12 years old. Okay, because that the peak for growth spurt. So we want to give them height as much as we can. After that, the height will get locked. And then estrogen replacement. If 9 to 13, we give estrogen. If more than 13 years old, we give combined estrogen and progesterone until menopause. Wow, this is important. So you gotta know that. We give estrogen and progesterone. Okay, so you add that here too. You give vitamin D, calcium, this is dietary consult, psych consult, and ophthalmology consult because they have eye conditions too. And then you give OB-GYN consult too. And then you counsel about regular diet, weight-bearing exercises, and medication compliance. Okay, because it's important, affect their whole growth spurt. Now for screening is something interesting. Every year you do physical exam, lipid, GGT, LFT, fasting glucose, UA, and you do ultrasound if UA abnormal. Okay, so this is every year. But every 5 years, what do? You do audiogram and DEXA scan. Okay, every 5 years. Every 2 years you do echocardiogram. Okay, so this is about Turner syndrome. We'll do really quick recap. You do karyotype, FSH, LH. After that, you check CBC, CMP, lipid, TSH, ultrasound of renal and pelvic, echo, bone, skeletal survey, hearing test, and then you treat. What do you treat with? Growth hormone, estrogen replacement. This is hormones, and then you give vitamin, calcium, and then you consult dietary, psych, ophthalmology. Okay, so you treat 3 modalities. Number 1, growth hormone, estrogen. Okay, and the second one, calcium, vitamin D. Third one, consult dietary and psych and counsel. Okay, OB-GYN. And then after that, screening. You screen every year with regular labs and UA and physical exam, and every 5 years with audiogram and DEXA scan, and every 2 years with echocardiogram. And this is the end of Turner syndrome. Thank you so much for listening, and we'll see you next one.